85% of the world's population don't even know that they have sleep apnea. They go to sleep not realizing that their tongue rolls back into their throat, blocking their airway for 15 minutes, 20 minutes, 45 minutes, even 1 hour plus. It could block your airway. This is very dangerous for your health. Let's talk about the types of sleep apnea. We have the obstructive sleep apnea. That is the muscles in your throat, which is large, compressing your airway whilst you're sleeping. We have the central sleep apnea. That is the brain neurologically is not sending signals to the rest of the body that wake up, you cannot breathe. It's very important. We have the mixed sleep apnea. That is the combination of the obstructive and then the neurologic or the central combined together. That is what we call the mixed sleep apnea. What are the early signs of sleep apnea? We have the brain fog. We have waking up with moody behavior. We have interrupted sleep. That interrupted sleep comes from you sleeping. That sleep apnea triggers your bladder so that you get up and use the bathroom multiple times at night. You wake up with headache. Let's pay attention to this. When you go to sleep and then there is oxygen deprivation towards your brain, it gives you headache. It's very, very important. We also have patients that have the loud chronic snoring. It's very important. They come up with fatigue. Pay attention. If we don't pay attention to these things, it could lead to major complications like hypertension. Yes, sleep apnea can give you hypertension. Hypertension can give you stroke from sleep apnea. Hypertension can give you heart attack from sleep apnea. Hypertension can give you arrhythmias from sleep apnea. Type 2 diabetes mellitus can come from sleep apnea. Memory loss is possible. It could come from sleep apnea. Fatigue, like I mentioned earlier, could come from sleep apnea. So we have to pay attention to it. What are the causes of sleep apnea? We have obesity. Once me and you lose this stomach around here, our breathing will return back to normal. Let me teach you something. We have a muscle over here called diaphragm. The stomach alone is compressing the diaphragm from expanding our lungs. If we lose the stomach, the diaphragm does a great job expanding your lungs, easily breathing good. Obesity is one of the major causes of sleep apnea. I promise you, you lose 20 pounds, you will return back to normal. The large tonsil is also part of the causes of sleep apnea. Age, when people who are 40 years and above, remember, once you are 40 years and above, it could be a high major risk for sleep apnea. Alcohol can be a major cause of sleep apnea. Nasal congestion. Before me and you go to sleep, please let's clear our nose. Because this nose, if we don't clear it, is going to unnecessarily cause our breathing to be compromised and then causing all these headaches, causing all this sleep apnea, causing all this oxygen deprivation. It's very important, okay? PCOS, that is a polycystic ovarian syndrome, one of the major causes of sleep apnea. Hypothyroidism, one of the major causes of sleep apnea. Now, what is the treatment the doctor is going to give me and you? The doctor is going to give us something called CPAP. The CPAP is a mask. It helps to regulate and helps to send good airflow into our lungs so that our throat does not close. Very important. Also, he could give us the BiPAP. The BiPAP is going to help with your exhaling, inhaling, exhaling, inhaling, so that you could get some great oxygen perfusion into your lungs. If this does not work, the doctor is going to do a surgical intervention. We don't want to get there, but eventually, if that is what will keep this sleep apnea, and if that's what's going to keep our breathing in check, then that's what we will have to end up resorting to. We should also manage our weight. The weight management will do it very great for us. Hormonal issues from the PCOS, once it is under control, it is going to help me and you. Sleep position, a lot of people don't even understand. When you sleep on your back is when the throat or when the tongue rolls into your throat. I would suggest that me and you should sleep on our side. And then we quit the smoking. We need to quit the drinking. And then we need to check the nasal care. Very important. I promise you, sleep apnea, we can overcome it. Sleep apnea could give you unnecessary stroke. It will start from hypertension. It will start from arrhythmias. It will start from stroke. It will start from heart attack. I promise you. Pay attention. Let's get outside and work out a little bit. Let's go for jogging. Let's go for power walking. Let's lose 10% of the body fat. Let's get our bodies back to normal. My name is Nurse Solomon, and I'll see you soon.